And welcome into To Your Health. You know, if you're 65 plus, there's probably a specialty that maybe you've not touched yet, but maybe it can touch you, and that's the specialty of neurology. And our guest today is Dr. William Levens. And Dr. Levens, you're a neurologist?
Yes, sir.
And
yes,
you are with the Baptist Neurology Clinic.
Yes, Baptist Health Neurological Clinic.
An old South Florida boy.
Yes, sir.
We found his way to Alabama, huh?
Relocated up here about 6 years ago.
Great.
And my wife and I just love the region, the people, and just couldn't find it in our hearts to leave. So we ended up moving to Montgomery towards the middle of the summertime.
Mm-hmm. We are so glad to have you, not just because you're nice and you're extremely intelligent, but because we also have a shortage of neurologists.
Absolutely.
And actually, we were talking earlier, what exactly is neurology?
And that's a question I get quite a bit. And neurology is a medical specialty that does training in specific years after medical school in the study of workings of the brain, the spinal cord, nerves, and the entire nervous system. So any problems or processes or conditions or things that touch one way of the brain or its extensions one way or the other falls under neurology. So a lot of different conditions we treat can affect young, old, men, women, multiple sclerosis, Parkinson's disease, seizures, sleep disorders, headaches, stroke, so there's a variety of things that neurologists cover.
You know, how would you know that you maybe have the onset of a neurological problem? In other words, like if I have a high blood count, I may be susceptible to cancer.
Sure.
But are there some telltale signs that somebody should get their self-checked?
Well, one of the hallmarks of a lot of the conditions that we see in neurology are kind of acute, unprovoked events that are changes that can't be explained by any other thing. Things that come unexpectedly, that affect any sort of movement, any sort of sensation, either things that you perceive in terms of your vision or things you feel, or any sort of numbness or any sort of strength loss or weakness. And there's a good chance that some way the nervous system could be involved. And especially if things are getting worse or progressing, if anything is changing in frequency, severity, duration of whatever thing it is, whatever spell may be going on that's not your usual state of health, it's probably a good idea to talk to your family doctor and ask their opinion about speaking to a neurologist. Unfortunately, there's a lot of folks out there that don't get to see a neurologist even though they should. And I think that definitely in our state, and especially in our region, it's certainly one of the more underserved areas in medicine.
And why would that be, that they're not able to see the neurologist? Is it because insurance doesn't want to cover it, or?
No, a lot of it is just stigmas, different barriers to health care, and just a lack of physicians to share the load of people that need to be seen.
That's the primary problem. I think that's probably the primary problem. Yeah. That's why we're so thrilled that Baptist has brought you here, so that we have access to you. And that brings another question Jack and I had talked about. Do you need a referral from your family physician, or can you go directly to you? What would be the wisest way to see you?
Self-referrals are fine. We accept those all the time. I generally recommend folks talk with their primary doctor or their cardiologist or whoever their treating doctors are first, and have them help refer the patient over, just because one of the things that's difficult with healthcare in terms of keeping costs down is trying to avoid repeating tests over and over again just because you didn't know that it was done or get the records. And so outside of just trying to help logistics and help get patients only get done the things that are going to help them get done, that's one of the main reasons why. And and partly because I'm not a general internist, I'm not a family doctor, and getting a lot of other medical conditions, making sure those are kept in check are going to be important alongside of our evaluation.
I did have another question, because we noticed that you specialized in epilepsy and seizures, and I think that's fascinating. I'd like to know what brought you to that.
Sure. After doing my residency at UAB in Birmingham in neurology, I spent an extra year studying epilepsy and EEG studies, as well as an additional year studying sleep medicine and sleep disorders. One of the areas that really I found to be important in neurology that I really enjoyed treating and was epilepsy and seizures, and that it's something that affects people of all ages, all races, men, women, and it's something that's fixable, curable, treatable. And unfortunately, there is a vast burden of undertreated seizures and undertreated epilepsy care worldwide. And there's certainly a need to improve on treating people around the world, and we have ways to do it. Even up to a third or more of patients that have had recent seizures or a diagnosis of epilepsy have not seen a neurologist in the past year. And trying to break down those walls of and stigmas with the condition that's been known for ages and ages of centuries, that it's not possession, it's not what a lot of times in historical texts were called the sacred illness, and even until the 20th century, even in our own country, there were laws prohibiting on the books people with seizures from marrying, from owning property, and a lot of people really don't get treatment that really should.
And it happens a lot to people 65 plus, doesn't it?
It is.
They're more prone.
Of the areas, the two big areas where epilepsy and seizures are the most seen in our population are in children, but even more so in those over 65, and that group is increasing the most.
Good. Well, thank you so much. We appreciate you being with us. We appreciate you being here. And just remember, if you feel that you have any kind of a situation that may cause you to see a neurologist, don't hesitate. Go to your GP, get him to recommend it. And we'll be right back right after this.